Hello everyone, hi, I'm Jewel. Welcome to my channel. Today's topic comes from the National Kidney Foundation. They made a statement on January the 11th that I think is very important that I would like to share with you. This is probably going to be a 2-video deal, so let's get started. The National Kidney Foundation statement: a path forward for increasing kidney transplantation. Chronic kidney disease affects more than 30 million Americans. It causes more deaths than breast cancer or prostate cancer, and approximately 90% of those with kidney disease don't even know they have it. The best treatment is early detection so that CKD, chronic kidney disease, can be slowed or stopped. Early treatment includes diet, exercise, and medications. However, once kidneys fail, treatment with dialysis or kidney transplant is needed to survive. Nearly 680,000 Americans have irreversible kidney failure or end-stage renal disease, which is ESRD, and need dialysis or kidney transplant. More than 475,000 ESRD patients receive dialysis at least 3 times per week to replace kidney function. Nearly 100,000 Americans are on the wait list for a kidney transplant right now. Depending on where a patient lives, the average wait time for a kidney transplant can be upward to 3 to 7 years. The National Kidney Foundation is calling on Congress and the administration to make organ transplantation a top priority and has identified several critical areas to be addressed from a legislative and regulatory standpoint. These priorities will increase a strategic and effective path forward towards increasing the number of kidney transplants and decreasing the number of patients who die waiting. Number 1, living donation. Expand financial assistance offered to living organ donors to cover all expenses related to organ donation, including lost wages, travel expenses, including transportation, lodging and food, child care or dependent care, expenses incurred during the donor's recovery, living donor medical care and follow-up care for donation, paperwork or legal costs related to the donation, and other expenses related to donations. Number 1B, pass the Living Donor Protection Act to ensure job protections for organ donors who need to take medical leave to recover from organ donation surgery and insurance protections so organ donors are not denied or charged higher premiums because they donated an organ. C, support community-based programs like the National Kidney Foundation's The Big Ask, The Big Give that seek to educate kidney patients and potential kidney donors on the benefits and risks of living donations. Number 2, Medicare and Medicaid reimbursement. 2A, align Medicare and Medicaid reimbursement to healthcare providers to encourage earlier care of CKD patients and preemptive transplant for those who do progress to ESRD. Number 3, the National Kidney Foundation has recommended a demonstration program to the Centers for Medicare and Medicaid Innovation that would take a patient-centered approach to testing changes in payment and care delivery. 3A, the program would put on emphasis on decreasing the demand for organs by preventing or slowing progression of kidney disease. For those who do progress to kidney failure, it would increase the number of people who receive a kidney transplant, ideally before ever needing to start dialysis. Number 4, permanently extend Medicare coverage for immunosuppressant drugs for kidney transplant recipients. 4A, currently patients who receive Medicare coverage for 36 months post-transplant, permanently extending Medicare coverage for immunosuppressant drugs for the life of the transplant is critically important. It will enable recipients to receive immunosuppressant drugs that they are required to take daily to help reduce the likelihood of organ rejection. For many patients, the costs associated with immunosuppressant drugs are prohibitive, leading patients to skip dosages or risk organ rejection, or in many cases, not trying to get a transplant. Okay, guys, we're going to stop right here on this first video of the National Kidney Foundation statement, A Path Forward for Increasing Kidney Transplantation. Guys, of course, I think this is a very important statement for all of us that are on dialysis and has transplants, because we need to find a way to pay for, our drugs that we need to take daily, and the Kidney Foundation is telling Congress that we need to do better by the kidneys patients and transplant patients. So guys, if you found this video useful, please like, share, and subscribe. And as always, we're thinking about you, sending you loving care, and knowing that you are not, doing this journey alone. And guys, the most important thing is always stay compliant to your doctor's orders and to be positive. And I will see you guys in the next video. Thank you. Bye.